for millions of people across India by being India's first contactless health monitoring solution that helps track chronic cardiac conditions, hypertension, and respiratory disorders through a device placed under the mattress. It is this remarkable endeavor that has earned Mr. Dantwade the recognition of Forbes 30 Under 30 in 2021. Joining him, we have Dr. Ashok Seth, chairman of Fortis Escorts Heart Institute. Having pioneered numerous angioplasty techniques for India and Asia Pacific region for the past 33 years, Dr. Seth holds one of the highest angiographies and angioplasties recognized by Limca Book of Records and have been bestowed with the national honor of Padma Shri in 2003 and Padma Bhushan in 2015.
10 years.
See, I would say the last 30 years, planting the valve.
Tier 2, Tier 3 cities are, not having the presence of the most competent hands. But being the diabetic capital of the world and having a very, very high
in coronary angiography, balloon angioplasty, stenting, valvuloplasty, and pacemakers, Pafosi under him seeks to simplify and transform healthcare for millions of people across India by being India's first contactless health monitoring solution that helps track chronic cardiac conditions, hypertension, and respiratory disorders through a device placed under the mattress. It is this remarkable endeavor that has earned Mr. Dantwade the recognition of Forbes 30 Under 30 in 2021. Joining him, we have Dr. Ashok Seth, chairman of Fortis Escorts Heart Institute. Having pioneered numerous angioplasty techniques for India and Asia Pacific region for the past 33 years, Dr. Seth holds one of the highest angiographies and angioplasties recognized by Limca Book of Records and have been bestowed with the national honor of Padma Shri in 2003 and Padma Bhushan in 2015. We also have Professor Vivek Gupta, intervention
valves. And by the way,
we are a very, very diverse country. It's a very, very wide and very large country. What do you see and how technology can help, sir?
Mridul, yeah, very pertinent question, especially when our Prime Minister Narendra Modi ji is trying to digitalize everything. But before I answer that question of remotely controlling Mars and all, I was on television on that day when finally something went wrong. I would like to add upon what Dr. Seth has already said, that I was privileged to be working with Alan Crevier in 1996, 97, 98, who is known as father of TAVI, which is the transcatheter aortic valve implantation. And at that time, it was in his mind only. Once he was driving his car, he said, Vivek, I have a project which will be opening without opening the chest, we will implant a valve. It went across my head and I could not understand that what happened actually. Finally, I went through the sheep model and he was doing an animal experimentation during that time. And then, of course, 2002, he did the first aortic valve implantation. The whole world was surprised and happily surprised. And Dr. Seth has taken it forward in India, especially by doing so many cases in Escorts Hospital. So that was one thing. Second landscape change was, of course, before that was 1977, when Brunswick did the angioplasty, just for the historical remembering, 1977. And then Dr. Sigwart in Lausanne, University in Switzerland, did the first stent implantation. These were the landmarks. And 2002, of course, 16th April, when Alan Crevier did the first aortic valve implantation. So it has come on ages now. And now the transcatheter aortic valve, what Dr. Seth has said, has become the first choice for especially the severely diseased stenotic aortic valve, especially in elderly population, also in minimally, even in the less risk or normal risk patients also. So these were the small things which I wanted to share my thoughts process, which I added upon what Dr. Seth has said. But coming on to your point, which is very important, India is a vast country, 137 crore population, lot of rural areas, villages, which is not even connected. And we don't have primary health centers which are having good enough facility to cater to the healthcare needs of the population so large and so diverse and so poor, I would say, poor in the sense because they are not able to afford a private healthcare. And secondly, private healthcare system is not available also in small villages. So as you said that remotely we controlled the landing on the Mars. Of course, something went wrong at the last stage. Similarly, now we have a telemedicine. You see, the COVID has taught us a lot of things. COVID has taught us how to do and utilize the digitalization by by doing webinars, of course, connecting many countries. We did 27 webinars during the COVID 1 and 2nd wave from Apollo Hospital, connecting so many countries and learning from their Italy, America, Belgium, Holland, England, so many things. So COVID has done a lot of teaching for all of us to do. And this is going to help India as such overall. So telemedicine, by which we can have the transmission of a local ECG, which can be done at the local primary health center and which can see in our television, this thing is going to help us, because finally you cannot have a best of doctors like Dr. Seth or myself or anybody going and seeing the patients. So we have two things now coming up. One is CT coronary angiography for prevention. Early diagnosis, early treatment is the crux to success. This always I've been saying, even for COVID. But for cardiovascular, we're talking on the World Heart Day. We are talking about prevention and mortality reduction and morbidity reduction can happen only by digitalization. Dr. Mridul, I would congratulate you for asking this question.
Thank you very much, sir. Thanks a lot. This brings me to Mudit. Mudit, a very young entrepreneur, and I think you took up the challenge of moving from
and patches which are going to monitor real-time NT-proBNP levels, hormonal changes, we're going to monitor electrical impulses, impedance, implantable micro devices.
Dr. Vivek again, and Dr. Vivek, like Dr. Seth just mentioned about miniaturization and micro sensors and sensors talking to each other, and a lot of computing happening on site inside the body. There is an implantable device which is already sitting somewhere next to your heart, getting signals, reading those signals, analyzing those signals. We all read how Apple Watch saved my life, the huge article and the huge, everybody was talking about it. So how do you see, some of these things and some of these ideas translating into, affordable healthcare, scientific solutions for the population as diverse as ours?
Very good question, but I think your question regarding the age difference, I would like to answer that a little. Why young people are getting more and more heart attacks, and then I'll take up this question of miniaturization, affordability. You see, our population, as you see, and you rightly said that when Dr. Seth was doing angioplasty of 65-year-old 20 years back, now we are seeing a lot of patients 35. I've done 24-year-old, 18-year-old, 19-year-old. The major reason, because this is going to be World Heart Day, and I think general audience is looking. We're not talking about, we're talking to the public masses. Major reason which I personally feel is actually the mental stress and high competition. Today, the young boy who is in the class 12th, class 11th or 10th, his parents are forcing to get the top marks, and there's a competition, there's a reservation, he has to compete, and this is going to be a mental stress itself leads to accelerated atherosclerosis. This is number one. Secondly, the junk food. Most of the people are eating outside today. Even my home, I cannot stop getting outside food, and you see the fat which is being used. The fat which is being used for making is again and again reused, and this is causing increased atherosclerosis and sometimes even the plaque rupture. Thirdly, of course, we are the diabetic capital, and of course these patients, we have incidence of blood sugar disturbances, and this has to be controlled. And fourth, more important, is obesity and overweight, especially in the urban population. So these four things have to be really curtailed, and we have to be a mass organization coming up from people like you, or from Fortis Hospital or private hospital, or from the government, that the junk food have to be avoided and regular exercises should be done. Coming on to the miniaturization and affordability group, and you said the question which you were asking, how the people who are poor, how the people who cannot afford a single watch, who cannot afford a mobile phone of 5,000. I mean, although the things are going up, but still the economy is not that great. Our country, whatever we say outside India, still we are developing country. We are still having a lot of poor population. So the people, I would say, Mudit, and people like other people who are really making in manufacturing, the stent cost has already come down to 30,000. In fact, it can further go down. This is one thing. The cost of angiography, angioplasty can be reduced further. But more thing for detection. If you see Apple Watch, it's costing about 80,000. It's very expensive. So everybody cannot have an Apple Watch and do the detection. So more and more local companies should come in and join this progressive thing where we can have almost all 100 crore population with completely digitalized and associated and connected to the bigger hospitals, whether it is a government hospital or it is a private hospital. So what we have to do from the government side, so already the GDP which is there, the fund allocation from the government is quite less as compared to developed countries. So we have to have a separate fund to digitalize this, and the Ministry of Health and Family Welfare should look into it, how to connect the people from the villages with the large villages. And I completely agree with Dr. Ashok Seth, who said, although artificial intelligence is there, but of course it cannot compete with the human intelligence. The human intelligence has to come in and again request the separate fund allocation so that something like watch, which may not be Apple Watch, which should be given to all the people of high risk, not everybody, the people who are at the high risk. We have to detect and segregate those people, and such kind of devices or machinery should be given to them. Last thing which I want to add upon this, as Dr. Seth also said, and now we have the pacemakers which are, if you when we're out of India, you are connected and they have a sensor which is connected to the patient's life, and lives can be saved. And he did a very right thing in controlling the atrial fibrillation because the video, the Apple Watch was showing it. So all these things, technology will come in, but to reduce the cost burden, the local companies should come in. Number one. Secondly, the fund allocation from the Ministry of Health and Family Welfare should come in, especially for this purpose. And it should be proper utilization of the funds, which is very important. Then only we can see a much lesser mortality and morbidity and faster detection so that we can treat them well.
Mridul, I know Mudit will have some important things to say, but if you just give me 1 minute only before we go to Mudit. Two important points. One, of course, smoking. Let's not forget smoking as one of the very important risk factors. And not just smoking per se, but passive smoking, where people are unfortunately allowed to smoke in atmosphere where they actually harm others. And therefore, every person who's listening to this should be aware that they should discourage smoking, not just stop smoking themselves, but discourage smoking anybody nearby. We should follow those laws and rules very clearly. Now, Mudit, please take over.
And will it be cost affordable to everyone?
So, first up, Dr. Seth, I really have to say thanks a lot for invite all of you that, while I am really passionate about this, what I lack is experience, so I need guiding hands like yours, and this was the learning session for me, what I was looking for. So with your direction, with my passion for technology, and we have many such people. I'm just saying, I'm not the lone warrior over here. There are lots of people, who can really change this world. We have to identify them, empower them, give them correct solutions which are to be built. And then, India, if that marriage between clinicians, that engineers, right, can be made, then we can really, change the world and make it a much, much better place.
Thank you, Mudit. Dr. Vivek, there's one question from Dr. Rachna Purani, and I would like to take that question to you. What is, how do we, take these developments to population? What kind of community programs that we need to drive? How do we actually educate our masses about, one, about the availability of the technology, and two, how this technology can be used for those people? Please, Dr. Vivek.
You very rightly pointed question, very important. You see the technology available, and you see this program which will record, will be although telecast. So you are doing a very small part of this, which is actually a drop in the ocean. So what I would suggest is that actually such program, for example, the one which we are talking today, should be more and more on television and where. But you see the TRP is not getting. Why the television will not show this program, all the channels will not show, because they don't get the TRP. So I think we have to have separate NGOs, non-government organizations, and of course the collaboration with the government, that whenever such a new things happen, especially it's a very huge cardiovascular burden. For the country where in India we run the 37 crore population, which has got a more and more younger population, also now aged population because of the increasing lifespan. The healthcare facility, the expenditure which is required for the whole country is huge. So best way is to prevent this. We have to look after 10 years what's going to happen. And that is when we can educate the masses so that we have a less preventive and early detection so that they don't land up with bypass surgery or angioplasty or mitral valve replacement or whatever. Or heart failure or devices where expensive devices are required and you require AICD or CI.